Well, this is National Dental Hygiene Month, and if you are living with diabetes, you should definitely listen up. Joining us now is a familiar smile. You've seen her on The Doctors and the Real Housewives of Miami. Now, Dr. Karent Sierra joins us to shed some light on the link between oral health and diabetes. Good morning.
Good morning, Molly. I'm especially very happy to speak to you in Milwaukee because I spent 4 years of my life there in dental school.
You did? Were you at Marquette?
At Marquette University. That is where I got my dental degree, so I'm very happy to be speaking to you.
Well, nice to speak to you too. We're having beautiful weather here in Milwaukee, so Milwaukee says hi to you. Interesting that you spent some time here going to school. Let's talk a little bit about what you know about oral health and this connection to diabetes, what people with diabetes need to know about their oral health.
Well, absolutely. Like you already mentioned, October is National Dental Hygiene Month, and Colgate Total has partnered up with the American Diabetes Association to launch a new campaign called Watch Your Mouth. Now, with this campaign, we're raising awareness concerning the link between oral health and diabetes. What a lot of patients aren't familiar or aware of is diabetic patients are 2 times more likely to develop gum disease.
See, I think that's so unfortunate. I have a cousin who has diabetes, and they already deal with so much and so many complications often related to their illness. So now they have to worry more about their oral health too.
Absolutely. You know, I have some easy recommendations, and some of them may seem very simple. Visiting your dentist at least every 6 months, making sure they do a good oral checkup and a good oral exam. And something as easy as brushing your teeth. 2-3 times a day is what I usually recommend. And studies have actually shown that brushing with Colgate Total twice a day, that in as little as 4 weeks, we actually see an improvement in gum health.
What about flossing? How important is that? How often should we be doing it? And should it be in the morning or at night?
Well, I usually recommend my patients to floss at night because at night you're able to remove any other bacteria, any other saliva that's in between the teeth, and you can go to sleep a little healthier. And a recommendation that I have for patients is keep it in their shower. A lot of patients forget. They put away their floss and they don't see it. So keep it in your shower. You stare at it when you're taking a shower, and you'll remember to floss at that time. And it's definitely very important to floss.
That's a great idea, the shower thing. I never thought about that. And I wonder, too, as we talk about this link to gum disease and people with diabetes, why is that they're more prone to gum disease than other people?
Well, the reason is that diabetic patients have high elevated blood glucose levels. Because of this, the body cannot heal from oral infections very easily.
What about diet? Is that important too as diabetics think about their oral health?
Absolutely. And you know, the easiest and most common sense is eating healthy, trying to stay to proteins, stick to vegetables with a lot of fiber, and a couple of fruits. What we have to remember, and especially with diabetic patients, is try to stay away from all the sweetie candies, all the sweets, and a lot of the complex carbohydrates that eventually within the saliva in our mouth will develop into sugars also.
Where can people go for more information? What kind of recommendation do you have if people want to learn more about this?
Sure. If you have more questions and want to read a little more, you can always visit our website, which is oralhealthanddiabetes.com.
Oralhealthanddiabetes.com.
That's correct.
And again, flossing at least once a day, and you suggest brushing 2 to 3 times a day for at least 2 minutes?
For at least 2 minutes. And sometimes we have little, sand clocks, or, you can think of you can be humming a song, in your mind. That always helps. Sing happy birthday, and you sing happy birthday all the way through, or little jingles like that will help you establish around a 2-minute timeline.
And a good routine. Great to have you on the show. Nice to meet you.
Nice to meet you too, Molly. Hope to visit you soon.
That would be great. Thanks again.